Pulvinak everyone, Dr. Lipate. I am the smoking cessation consultant for the Hope Clinic in Suva. And today we're partnering with the World Health Organization, the Ministry of Health and Medical Services, and Hope Clinic to bring to you the cessation program for Fiji. And yeah, very happy to be here today. And over the next couple of minutes, we'll teach you how to be part of the smoking cessation pathway, particularly with how to screen and refer tobacco users or moderate to high dependent tobacco users to the respective hub centers where they can get treatment. So very quickly, the objectives of the cessation program is to let you understand the background to the referral pathway and how to screen a patient and refer them to the cessation hubs, so the tobacco cessation hubs that we have set up around Fiji, and so that you can know your role in helping to create a smoke-free Fiji. So this is things that we already know, that tobacco is a killer. And yearly we lose about 8 million lives because of tobacco, and we also lose another 1 million because of secondhand smoke. And so we know it's bad. But bringing things home to Fiji, according to the IHME website, when you look at Fiji's profile over the last decade, from about 2009 to 2019, 3 of the top 10 causes of death had to do with the respiratory system. So diseases like asthma, lower respiratory tract infections like pneumonia, and chronic obstructive pulmonary disease were amongst the top 10 causes of death of Fijians. So we know that taking care of our respiratory system and our breathing is extremely important. When you look at the factors that drive the most death and disability, factor number 5 is, or the risk factor, is the use of tobacco and tobacco-related products. So basically smoking your cigarettes, your suki, and even your electronic cigarettes, which is slowly becoming more popular today. When you look at studies that looked at COVID-19, for example, this particular one published in the BMC Public Health identified 46 studies altogether with a participant list of about 22,000 people who had COVID-19. And what they found was if you were a smoker, if you were a tobacco user, then your chance of dying from COVID-19 was much, much higher. And it's interesting because these effects seem to be higher in younger people. So younger smokers are at risk of dying from COVID-19 compared to people in the population who didn't smoke. So is tobacco smoke relevant? Is getting patients to stop smoking relevant? Absolutely. Now, unfortunately, when you look at the data, the best data that we have at the moment in Fiji is the STEP survey, which was done over a decade ago in 2011. Now, this particular survey had a few weaknesses, and one of it was it didn't really separate the use of cigarettes from what we call traditional smoke, like suki or moro or uma. And it didn't really differentiate the different types of traditional tobacco that's used. And I'll give you an example. So this is moro. It's a way of processing the tobacco leaves. And this is smoked in a different way compared to uma. This is the actual tobacco leaves. And this is smoked again in a slightly different way. And this is the traditional suki. So if you ask somebody who smoked moro whether they took suki, the chances are they'll say no. And if you ask someone who smoked uma whether they smoke cigarettes, the chances are they'll say no as well. So the next time we do the STEP survey, we're going to be more specific, because what we know is more and more people are making the shift from cigarettes sold at the shops to the more traditional ones like suki, moro, and uma. And we need to be able to pick up this this group, because there, again, evidence which suggests that the nicotine level, which is the addictive level, the addictive chemical that's present in tobacco, is much higher in the natural products, and it's regulated in the store-bought tobacco. So we've got a big problem on our hands in terms of tobacco or nicotine addiction. Now, we must differentiate between the social smoker from the actual addict, or the person who's got high dependence. And if you look at ICD-10 or the DSM criteria, they're pretty specific on this as a diagnosis, which means that if you are addicted to tobacco, if you're addicted to using cigarettes, it's actually a mental health disorder. And because it's a mental health disorder, it requires a very holistic looking treatment. And till today, that was not provided here in this country. But thanks to the support that we've had from the Ministry of Health and Medical Services and the World Health Organization in partnership with Hope Clinic, we've been able to set up some of these hub centers around the country where you'll be able to identify patients who are dependent on tobacco and get them the treatment that they need. So the social smoker, the person who smokes, occasionally 1 cigarette, 2 cigarettes, maybe a week, that's not really the person that we're trying to address. We're trying to address the person who wakes up in the morning and needs to have a cigarette to start his or her day, because those are the people who are very likely to be dependent, and they are the ones who would need the specific intervention. So types of interventions, basically they're divided into 2. Something called the psychosocial intervention, where you help them make almost a choice, make the right choice. It's almost like a lifestyle choice. In fact, it is a lifestyle choice. You get them to make the change mentally to say, I'm going to wake up in the morning and I'm not going to have a cigarette today. And there's a lot of ways you can go through that. But also, especially for the patients who are dependent or addicts, we need drugs. And the drugs would help to lower the levels of nicotine and the effect that nicotine has on the person. And together with the psychosocial interventions, we'll slowly be able to work with the patient to break the habit, and that's what we want. What we also know from studies is the longer time you spend in counseling, the higher the chance of the person quitting. So we know that higher intensity counseling has a much higher chance of getting the person to quit. Now, for those of us who work in health centers like Valilevu or Makoi, or even in Nandi, you come across a patient who's been smoking, you ask them whether they smoke or not, it's going to be very difficult to spend the next half an hour with them to try to get them to quit, because you've got a line of people waiting outside. So what we want to do today is to teach you how to very quickly screen them, so you know which patients need the intervention and which patients don't. And the ones who really need the intervention, you don't have to spend much time on them. You just refer them to the special cessation hubs. And that's basically what this video is for. So again, looking at the types of cessation that's available, this is what we're doing in Fiji. It's a combination of the psychosocial intervention as well as the use of drugs known as nicotine replacement therapy. And currently this is being supplied to us by the World Health Organization in 3 forms: a patch, a chewing gum, or a lozenge, which is a type of lolly. So for your patients that get referred to these hub centers, they are offered these drugs as treatment. Now, this is the smoking cessation pathway for Fiji. I apologize that it's a little bit busy, but we'll go over this pathway very quickly, and it's actually very simple to understand. So the first thing you get, and this is supposed to be one of the most basic questions that you ask whenever you see a patient, regardless of if it's outpatients or SOPD, or maybe you've got patients waiting in the hall and you have a nurse looking after the clinic. This is always a question that she can ask, and it's simply, do you use tobacco? Not do you smoke, because tobacco is used in different forms, but do you use tobacco? And if the answer is no, very quickly, another 2 questions: have you ever used it? And if they say yes, you can explore, if you've got time on your hands, explore with them their reasons for quitting. And that person could be used as maybe a champion in your SOPD. But if they say no, that they've never ever used tobacco, encourage them to continue down that path of healthy living. And that's simple. That's the end of it, basically. Now, the difference is if they say yes. So if they say yes, then you're going to start looking into very quickly trying to screen them. And so very quickly, it's like this. So you get a patient. Do you use tobacco? The answer is yes. Okay. You've come in for example, he's come in for a headache or some viral infection. You can advise them that you can relate it. So your viral infection is made worse by the fact that you continue to smoke. Okay, so you get them thinking down the line that, okay, this is something that I need to give up. And then what you need to do very quickly is assess two things. Number one, their readiness to quit, their readiness to stop smoking. Okay, because of the fact that we want to diagnose addicts, in order for addiction treatment to work, the person has to first acknowledge that they've got a problem and that they want to take the steps to quit. So you need to assess whether the patient is ready to make a quit attempt. And you just assess that by asking two questions. Number one, would you like to quit tobacco? And if the answer is yes, that's your man. If the answer is they're not sure or no, then this is not the person that you will send to the hub center. The second question is, do you think you've got a chance of quitting successfully? If the answer is yes, or they're not really sure, that's your man. But if the answer is no, they don't think they have what it takes to quit, they're not ready. That's it. So that's all you need to do to assess their readiness to quit. Then the second one is to assess their dependence, or to assess their addiction level. And again, it's only two questions. The first is what's called TTFC, the time to first cigarette. Okay, so when you wake up in the morning, how quickly do you have to have a cigarette? Is it within 5 minutes, or is it within 6 to 30 minutes, or 30 to 60 minutes, or longer than that? That's a key question. So time to first cigarette. And the second one is, how many cigarettes per day, CPD? How many cigarettes per day do you smoke? So again, you're in a busy clinic. The person has agreed that yes, they do smoke. They're fulfilled that yes, they want to quit. You do the dependence on tobacco. It's called the Heaviness of Tobacco Index, HSI. And you only ask time to first cigarette and number of cigarettes per day. Then they'll tell you, oh, I smoke maybe 10 cigarettes a day or 20 cigarettes, that sort of thing. Then very quickly, you do your assessment. And the assessment is based on a score. So if they wake up in the morning, first thing they do is pop a cigarette, they get a score of 3. If they smoke more than 30 cigarettes a day, so 3 packets of Bate-10 a day, or I guess 30 rolls of Suki a day, then they get a score of 3. Anything above 3, so 4 and above, moderate to high, that's your high dependence person. That's the person that we need to see at the hub centers. So time to first cigarette and cigarettes per day. So once you've managed to diagnose that a person is ready to make a quick quit attempt and fulfills moderate to high dependence, they get referred to the hub centers. Now, if they don't, if they're not ready to quit, or they don't fulfill the dependence on tobacco, then we move to something called the 5 R's, which is basically the relevance, make cigarette smoking or giving up the use of tobacco relevant to them. You can explain to them the risks. Like if you don't stop smoking now, I gave the example earlier, it will increase your chance of dying of tobacco, for example. The rewards, if you stop smoking, you'll benefit from it financially. In terms of your health, you'll benefit. You'll feel better. You're protecting your environment for your kids. And then you can look at even addressing the roadblocks. What's preventing them from quitting? I smoke with a lot of friends who smoke cigarettes, or I only smoke cigarettes when I drink grog. Address those roadblocks, go with them. And if it doesn't work, that's fine. The next time you come in, just repeat it all over again. At some point, when they're ready to make the quit attempt, that's when you refer them. But remember, if they're not ready, they're probably not going to be successful at the quit center. So once again, the cessation pathway, very simple. Ask, do you use tobacco? If their answer is no, let them go. Continue positively reinforce that they'll continue to be healthy as long as they don't smoke. If they say yes, then very quickly assess their readiness to quit, asking them those 2 questions, whether they're ready to quit, whether they think they'll make a successful quit attempt, and then assess their dependence on tobacco, the time to first cigarette, and the cigarettes per day. And if they fulfill moderate to high dependence, then you refer them to the hub centers. If not, do the 5 R's. Now the last part, but the most important part, the hub centers. So where are these located? The Central Division has the highest population of Fiji, and therefore we have the highest number of hub centers here. The Diabetic Hub in Waimanu Road, opposite Labour Ward, that's a cessation hub. So you can contact anybody at the Diabetic Hub and they'll be happy to take in your patients. The Sexual Reproductive Health Clinics, that's at Rodwell Road, next to the Immigration Department, and also Hope Clinic at my FNPF Plaza. Any of these centers, feel free to refer your patients there. In the Western Division, we only have one place in the Western Division, and that's in Naviti Street, which is opposite the old MCH clinic, for those of you in Lautoka, opposite Lautoka Hotel. That's the Sexual Reproductive Health Clinic there. We have lots of trained people there as well who are happy to take your patients. And also in Lambasa, the Sexual Reproductive Health Center in Nasea, and the Diabetic Hub, which is part of Lambasa Hospital. Those are your key focal areas. Once you've diagnosed a patient with moderate to high dependence on tobacco, those are the places you refer them. Now, this is just generally our suggestion, but if you come across somebody who you deem as high risk, somebody who absolutely needs to stop smoking, you can also refer these people to the hub centers. But as much as practically possible, like I said, try and do the assessments on them to determine whether they're moderate to high tobacco users or tobacco dependents. Now, just very quickly at the hub centers, what we do is we go through a pathway that basically just gets them in, establishes rapport. We take consent. We fill in what's called an intake form, and we start something called motivational interviewing, which is a special interviewing technique that empowers the person to basically make the healthier change. And so motivational interviewing is done, and at the end of it, we prescribe nicotine replacement therapy. Usually the mainstay is a patch plus a gum or lozenge, and then the process carries on for about 12 weeks, depending on how well they adhere to the program. And we've had quite a number of successful Fijians who've been smoking for 30, 40 years, who never thought that they'd ever quit smoking. They've successfully stopped. And it's only because of an intervention like this. So you have access to this now. You can send your patients, your relatives, or even yourself, if you've just diagnosed yourself in the past few minutes as somebody who's got moderate to high dependence on tobacco, and you know where to go now. And just to end, we'd just like to acknowledge the late Dr. Tukana, who said, "Let's work together for a smoke-free Fiji." Thank you very much.